You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Marc Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 3, the use of radiography in assessing foot balance.
Introduction.
The balance of the equine foot is a critical component in maintaining soundness, biomechanical efficiency, and long-term limb health. Historically, farriers and veterinarians have relied primarily on visual and tactile assessments to evaluate hoof balance and determine trimming or shoeing needs. However, these methods, though valuable, are inherently limited by the external nature of the observations. With the advent and increasing accessibility of diagnostic imaging, particularly radiography, foot balance can now be assessed with far greater precision. Radiographs offer detailed insights into the internal structures of the hoof, allowing clinicians and farriers to evaluate bone alignment, joint congruity, hoof capsule orientation, and pathological changes that are not visible externally. By integrating radiographic findings into farriery planning, farriers can develop more tailored and effective trimming and shoeing strategies, ultimately improving equine welfare and performance. Foot balance is a complex and multifactorial concept that refers to the harmonious alignment and proportional distribution of forces across the hoof and limb. It encompasses aspects such as mediolateral symmetry, dorso-palmar or dorso-plantar alignment, digital alignment, and the orientation of the hoof capsule relative to internal structures. Dyson and Murray, 2007. While no single definition of ideal foot balance exists, and individual variations are common. Significant deviations from biomechanical norms are associated with an increased risk of lameness, joint disease, tendon and ligament strain, and hoof pathology, O'Grady and Poupard, 2003. Radiography allows these deviations to be detected objectively and early, even in the absence of clinical signs. Routine radiographic assessment of the equine foot typically involves a series of standardized views including the lateromedial, LM, dorso-palmar, DP, or dorso-plantar for hind limbs, and solar or skyline views. These projections provide complementary perspectives on the hoof's internal anatomy. The LM view is particularly informative in assessing dorso-palmar alignment, palmar angle, phalangeal alignment, and the orientation of the distal phalanx P3 relative to the hoof wall. The DP view assists in identifying mediolateral balance, the presence of medial or lateral flaring, and asymmetries in joint spacing or hoof wall thickness. Butler et al., 2008. Radiographic measurements can also quantify the solar angle, hoof pastern axis, sole depth, and the distance between the extensor process and the coronary band, each of which contributes to a comprehensive picture of hoof health and balance.
The hoof pastern axis.
One of the key indicators derived from LM radiographs is the hoof pastern axis, HPA, which reflects the alignment of the dorsal hoof wall with the dorsal cortex of the pastern bones. A broken back HPA, where the dorsal hoof wall diverges from the pastern in a distal direction, suggests an underrun heel or long toe, and has been associated with increased strain on the deep digital flexor tendon, DDFT, and navicular structures, Clayton et al., 2011. Conversely, a broken forward HPA may indicate an excessively upright hoof or clubfoot, potentially predisposing the horse to high ring bone or suspensory dysmitis, Turner, 1992. Radiographic identification of HPA deviations guides trimming strategies aimed at realigning the hoof pastern axis. For example, Reducing toe length and improving heel support through trimming or therapeutic shoeing can help correct a broken back axis.
The palmar angle.
The palmar angle, PA, the angle between the solar surface of P3 and the ground, is another critical parameter accessible through LM radiographs. A normal PA in front feet typically ranges from 2 to 5 degrees, although individual conformation must be considered. A negative or 0 PA, where the solar surface of P3 is parallel or angled upward relative to the ground, is often seen in horses with underrun heels, long toes, or chronic laminitis, Kummer et al. 2006. Such alignment increases tension on the DDFT and contributes to heel pain, navicular syndrome, and digital cushion collapse. Radiographs that reveal a low or negative PA inform trimming strategies that focus on reducing dorsal wall leverage and encouraging heel growth, often through the application of wedge pads or heel support devices.
Mediolateral balance.
Mediolateral balance, assessed from the DP view, is another key consideration. Ideally, the joint spaces across the distal interphalangeal joint should be symmetrical, and the medial and lateral walls of the hoof should exhibit similar height and thickness. Asymmetries suggest mediolateral imbalance, which can contribute to asymmetric loading, abnormal wear, and degenerative joint changes. Weller et al. 2006. Horses with medial lateral imbalance may also exhibit flaring, hoof capsule distortion, or side bone formation. Radiographic identification of these imbalances guides corrective trimming, such as selectively lowering the higher wall or adjusting breakover points to restore symmetry in loading patterns.
Sole depth.
Radiographs also allow accurate assessment of sole depth, the vertical distance between the solar margin of P3 and the outer sole surface. A sole depth of less than 10 to 12 mm is generally considered inadequate, particularly in working horses, and may predispose the animal to bruising, corium damage, or pedal osteitis. Dyson, 2011. Insufficient sole depth may not be visibly evident externally, but can be easily measured radiographically. In such cases, farriery interventions may involve reducing loading on the thin-soled area, applying protective pads, or adjusting trimming intervals to allow sole regrowth. Deep digital cushion integrity and the position of the navicular bone are also better appreciated with radiographs, particularly in horses with suspected heel pain or navicular syndrome.
Radiography and pathology.
Perhaps one of the most valuable uses of radiography is in the formulation of farriery plans for horses with pathology. In case of laminitis, for example, radiographs are essential to quantify the degree of rotation or sinking of P3 relative to the hoof capsule. Pollitt, 2004. The distance between the dorsal surface of P3 and the dorsal hoof wall founder distance, the angle of rotation, and the displacement of the coronary band provide crucial information for determining the severity and chronicity of the disease. Therapeutic trimming and shoeing, such as realigning P3, unloading the toe region, or applying supportive frog pressure, can then be planned with precision. Moreover, serial radiographs can be used to monitor progress and adjust the farriery protocol over time. The integration of radiographs into farriery is most effective when there is collaboration between the veterinarian and the farrier. Radiographs are not a replacement for skilled hoof assessment, but rather a complementary tool that enhances clinical judgment. Many farriers have now adopted radiographic consultation as part of routine or remedial hoof care, and portable digital radiography has made it easier than ever to acquire high-quality images in the field. Case studies have demonstrated improved outcomes in horses with chronic lameness, navicular disease, or conformational abnormalities when radiographs are used to guide shoeing decisions. O'Grady and Morrison, 2004.
Radiography in clinical practice.
In performance horses, radiographic assessment is also valuable as a preventative tool. Subtle imbalances or early pathological changes may be identified before clinical signs emerge. For example, early changes in navicular bone morphology, such as cysts or sclerosis, can prompt farriery adjustments that reduce loading on the heel and delay progression. Dyson and Murray, 2007. Likewise, radiographs in young horses can identify developmental orthopaedic diseases, DOD, such as flexural deformities or incomplete ossification, which may benefit from early farriery intervention to guide proper hoof conformation. Despite its advantages, radiographic assessment has limitations. It provides a two-dimensional image of a three-dimensional structure and is susceptible to positional artifacts and variability in projection angles. Poor radiographic technique can lead to misinterpretation and inappropriate farriery decisions. To mitigate this, standardized positioning protocols have been developed, and radiographs should always be interpreted in the context of clinical signs, limb conformation, and gait analysis. Butler et al. 2008. Additionally, the cost of radiography and access to trained personnel can be a barrier in some equine practices, particularly in non-specialist or rural settings. Advances in imaging, including the use of three-dimensional imaging, CT and MRI, have begun to supplement radiography in complex cases. However, these modalities are often impractical for routine use due to cost, availability, and the need for general anaesthesia. Therefore, radiography remains the most accessible and cost-effective imaging tool for hoof assessment, especially when integrated into a holistic approach that includes conformation analysis, dynamic observation, and clinical palpation.
Conclusion.
In conclusion, radiography is a powerful and indispensable tool in assessing foot balance and formulating farriery plans in horses. It provides objective and detailed information about internal hoof structures, enabling the diagnosis of imbalances, pathological changes, and deviations that are not externally visible. By guiding trimming and shoeing decisions, radiographs help restore and maintain biomechanical alignment, reduce the risk of injury, and enhance performance and comfort. The use of radiographs is especially important in cases of chronic lameness, laminitis, or complex conformational abnormalities. As the technology continues to advance and interdisciplinary collaboration improves, radiographic assessment is poised to become an even more integral part of routine and therapeutic hoof care. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.